little tennis elbow.
Got it. So if we go to MI, mechanically inconclusive, what are you going to see, and how might you tailor your physical exam that's going to help you rule that in or weigh that toward or against?
So if I had to compare mechanically inclusive to derangement, for example, we know derangement has loss of motion most of the time.
Yep.
So we expect to look for loss of motion, but we also have directional preference. Mechanically inclusive most of the time has loss of motion, but there is no directional preference. So we can make her worse, and it tends to flip-flop. What may look like directional preference today made her worse coming back on day 2. Oh, that made me worse. I had to stop. And on day 1, if we tested her and found a direction made her worse, that actually might make her better on day 2. And then it flip-flops again. So there's really no consistency. So we can't say directional preference, because with derangement, it's going to be consistently variable.
Gotcha.
With the directional
All
preference.
right, we'll get to how you handle that. Yeah. We'll get to how you might address and manage that condition later when we get through the physical exam. But that's helpful, I think. You said, okay, I guess it could be medial and lateral epicondylitis.
Yeah.
What do you see that might allow that to be a plausible classification? What do you see that really doesn't?
Plausible wise, just the chronicity of it, and she's not getting any rest. She's having to continue to use her arm and function without giving it a break. And so that could cause an inflammatory response. Now it's hurting at rest. So there's some viability for that to be, epicondylitis or epicondylalgia with an itis in there.
Yeah.
But to be that chronic, before he fractured his fingers and it's still hurting her, less likely.
Yep.
Right.
Okay.
Especially bilateral in the elbow. It's not that common. And, when I asked her, if you can recall a year ago, medial versus lateral, which one started first?
Mm-hmm.
And they started at the same time.
Got it.
So more unlikely to be truly epicondylitis.
Yeah, very good. Month after month, new guest experts like Jonathan Dolutan sharing actual patient cases like this one and access to all the past. Check out case conversations at mechanicalcareforum.com.